Please listen to me carefully. I am a doctor with over 21 years of experience in emergency medicine. For many years, I tried to understand why some hearts cannot bear the strain, even when people follow the right diet. They eat oatmeal, salads, and low-fat foods, trying to follow recommendations, but their arteries still clog. This question troubled me for a long time until a research group I collaborated with in Japan conducted revolutionary research. We tested 83 different products: natural fruits, seeds, herbs, powders, and even spices, adding them to regular oatmeal. Using live scans of arteries, we measured blood flow and plaque response in elderly individuals over 60. Most of the tested products showed no results, and some even worsened the situation. However, 6 of them, just 6, completely changed our observations. The arteries opened, blood began to flow freely again, and inflammation markers decreased. These 6 products are completely natural, accessible, and already present in most kitchens. They act by increasing the level of nitrogen oxide, a molecule that relaxes and dilates arteries, helping to eliminate sticky cholesterol that causes dangerous blockages. I strongly urge you not to overlook this information, as out of 80 tested products, only 6 are truly effective. In this video, I will tell you about them and how to use them. Stay with us until the end, because the most powerful one is in first place. This has been confirmed in Japanese cardiology laboratories and restores blood flow by more than 60% in just 2 months. The information has been verified in international cardiology journals. Before we continue, I have a question for you. How do you start your morning? Write in the comments. We read and respond to every message carefully because your story can change someone's life. Now let's move on to number 6, the first ingredient that turned ordinary oatmeal into a heart miracle. Number 6, flax seeds. These tiny seeds may seem insignificant, but they possess cardiovascular power that surprises even the strongest medicines. These small brown seeds contain the highest concentration of plant omega-3 fatty acids in nature, alpha-linolenic acid, which the body transforms into the same protective compounds for the heart as fish oil. A groundbreaking study tracked 110 participants with hypertension over 6 months. Those who added just 2 tablespoons of ground flax seeds to their daily oatmeal were able to lower their systolic pressure by 15 points and diastolic by 7. This is comparable to the effect of prescription drugs for lowering blood pressure, but without side effects. The secret lies in lignans, phytoestrogens that act as natural inhibitors of angiotensin-converting enzyme, relaxing blood vessels, and increasing their elasticity. To achieve maximum effect, flax seeds must be ground just before use. Whole seeds pass through the digestive tract unchanged, resulting in the loss of all their cleansing properties. It is best to buy whole seeds and grind them in a coffee grinder or powerful blender just before adding them to the oatmeal. After grinding, the seeds begin to oxidize and lose their effectiveness, so it's better not to buy ready-made flaxseed flour if you seek the full benefits for the cardiovascular system. Heat enhances the bioavailability of lignans, so adding ground flax seeds to hot oatmeal is a great solution. Start with 1 tablespoon a day in the first week to allow your digestive system to adapt. Gradually increase the portion to 2 tablespoons. The timing of addition also matters. Add ground seeds after the oatmeal has cooked and cooled for about 2 minutes. This is the ideal temperature, around 60 degrees Celsius, preserving delicate omega-3s and allowing lignans to activate. Thoroughly mix and let it steep for 30 seconds so the seeds absorb the liquid. This will simplify digestion and increase nutrient absorption by up to 40%, according to studies. The 5th important addition is turmeric. She has long left the kitchen for making curry. Realizing what she is doing to your arteries, you will never look at this golden spice the same way again. The active substance of turmeric, curcumin, is recognized in more than 12,000 peer-reviewed studies as one of the most powerful anti-inflammatory agents on the planet. But what makes turmeric especially beneficial for arteries? It restores the endothelium, the thin inner lining of blood vessels. When this shell is damaged, the process of plaque formation begins in the body. One study involved 121 people after coronary artery bypass surgery, and half of them were given curcumin daily. In just 8 weeks, the group receiving curcumin had a 65% lower risk of heart attack compared to the placebo. Researchers found that curcumin helped repair damaged arterial tissue and improve the function of existing vessels. However, there is a problem. The body poorly absorbs turmeric. Simply sprinkling it on oatmeal is not enough, as curcumin itself has low bioavailability. It is important to prepare turmeric correctly. To increase its absorption by 2,000%, it must be combined with black pepper and healthy fat. Here is the exact method for maximum benefit for the arteries. Mix 1 teaspoon of turmeric powder with a quarter teaspoon of freshly ground black pepper and 1 teaspoon of coconut oil or ghee. Heat this mixture over low heat in a small pan for 30 seconds until fragrant. Then add it to the cooked oatmeal. Pepperine in black pepper slows down the liver's breakdown of curcumin, and fat helps it pass through the intestinal wall. This combination maintains therapeutic levels of curcumin in the blood for up to 8 hours. For maximum effectiveness, eat oatmeal with turmeric 20 minutes before any other morning meal. This will allow optimal absorption of the substance when stomach acid levels are at their peak. The warmth of oatmeal also activates curcumin, making it more accessible to the body compared to cold supplements. Turmeric is just the beginning in protecting arteries with spices. Ceylon cinnamon ranks 4th. However, not all cinnamon is suitable for protecting arteries. Most cinnamon available in stores is cassia, which contains high levels of coumarin that can harm the liver in large doses. Unlike her, Ceylon cinnamon, known as true cinnamon, contains 250 times less coumarin and much more substances that positively affect arterial health. One important study showed that adding just half a teaspoon of Ceylon cinnamon to food reduced triglyceride levels after meals by 30%. This is especially important as a high level of triglycerides after meals is one of the most reliable predictors of cardiovascular diseases. Cinnamon actually prevents the clogging of arteries by fats. In real time, Ceylon cinnamon contains unique proanthocyanidins that act like microscopic brushes cleaning the arteries. These molecules break down the protein matrix binding arterial plaques, allowing the body to naturally eliminate dangerous blockages. The method of adding Ceylon cinnamon to oatmeal is also important for its effectiveness. Never add cinnamon to boiling oatmeal or very hot liquid. Temperatures above 82 degrees Celsius destroy many beneficial compounds. It's best to let the oatmeal cool to a comfortable temperature. Then add half to 1 teaspoon of Ceylon cinnamon along with a small pinch of vanilla extract. Vanillin found in vanilla increases the bioavailability of cinnamon and helps its compounds better absorb into the walls of arteries. Mix thoroughly and let the mixture stand for 2 minutes before consumption. This time allows the cinnamon to release essential oils and activate artery cleansing compounds. For even more noticeable results, try making overnight oats with Ceylon cinnamon. Prolonged contact ensures maximum extraction of nutrients. Mix the oats with your chosen liquid, add cinnamon, and refrigerate overnight. In the morning, heat it gently, not exceeding 60 degrees Celsius. Research shows that this method increases the bioavailability of active compounds in cinnamon by 45% compared to adding it to hot oatmeal. It was also found that Ceylon cinnamon improves endothelial function within 2 hours of consumption. Measuring flow-mediated dilation, scientists found a 23% improvement in how well arteries expand with increased blood flow after consuming cinnamon. This instant effect, combined with the long-term reduction of plaques, makes Ceylon cinnamon one of the most powerful additions to morning oatmeal. Now let's focus on something that might surprise you as an artery protector. In 3rd place are raw cocoa nibs. Raw cocoa nibs are probably the tastiest way to cleanse arteries, and the scientific data about them will amaze you. They are not ordinary chocolate chips, loaded with sugar and dairy fats. Raw cocoa nibs are natural, unprocessed chocolate in its most concentrated form, having the highest flavonoid content among all products. A study conducted by Harvard University involved 21 participants over more than 11 years, showing that regular consumption of flavonoids from cocoa reduces the risk of myocardial infarction by 39% and stroke by 29%. Scientists have found that cocoa flavonoids begin to improve arterial functions just 2 hours after consumption and provide a cumulative effect with daily intake. The main magical component is epicatechins, which promote the production of nitric oxide in the artery walls. Nitric oxide acts as a lubricant for the cardiovascular system, maintaining its flexibility and smoothness. In the study, participants were given 50 grams of raw cocoa every day for 2 weeks. Ultrasound research showed a 21% improvement in artery flexibility and a 32% increase in blood flow. Participants' pressure decreased on average by 10 points systolic and 6 diastolic. But the most astonishing discovery was that cocoa helped reduce arterial stiffness, which typically occurs with age. Participants over 60 showed even more significant improvements compared to the young, indicating that cocoa may slow the process of arterial aging. To maximize the benefits of raw cocoa for arteries and oatmeal, add 2 tablespoons of the product after the temperature drops to 48 degrees Celsius. This will prevent the destruction of heat-sensitive polyphenols responsible for cardiovascular benefits. Let them steep in warm oatmeal for 3 to 4 minutes to soften slightly and release beneficial nutrients. Do not cook or add to boiling oatmeal, as this can destroy up to 70% of beneficial flavonoids. To improve absorption, combine cocoa nibs with a source of vitamin C, such as fresh berries or a few drops of lemon juice. Vitamin C protects flavonoids from oxidation during digestion and increases their absorption by up to 50%. In addition, cocoa nibs contain a significant amount of magnesium. 2 tablespoons provide 25% of the daily norm. Magnesium relaxes the smooth muscle of the arteries and regulates the heart rhythm. This combination of flavonoids and magnesium makes raw cocoa nibs one of the best defenders of arteries for morning oatmeal. Get ready for the next item. Its effects are so impressive that pharmaceutical companies have tried to synthesize its components. Pomegranate seeds take second place. Natural treasures for cleansing arteries. Recent studies have shown that they can reverse blockages that have accumulated over the years. These ruby red seeds contain a unique combination of punicalagins and ellagic acid that synergistically protect and restore the cardiovascular system. In a 3-year study, patients with severe coronary artery stenosis were given pomegranate juice daily. After a year, the incidence of blockages in the placebo group increased by 9%, while in the pomegranate juice group, it decreased by 30%. By the 3rd year, some participants managed to clear up to 35% of dangerous blockages. Researchers called this an unprecedented approach to atherosclerosis solely through diet. Fresh pomegranate seeds significantly surpass juice. They contain fiber that slows sugar absorption, as well as a complete set of protective substances. To get the most benefit from the pomegranate seeds added to oatmeal, it is important to adhere to the exact timing. Add half a cup of fresh seeds when the oatmeal has cooled to a comfortable temperature for consumption. The warmth of the oatmeal promotes the slow release of juice from the grains, creating pockets of flavor and preserving fragile polyphenols. It is necessary to chew the seeds thoroughly rather than swallow them whole. Mechanical chewing breaks down the seed coat and activates punicic acid, which, according to studies, reduces artery inflammation by up to 48%. To enhance the effect, add grains with a teaspoon of raw honey. Enzymes found in raw honey aid in the better absorption of polyphenols from pomegranates, protecting the stomach from the destructive effects of acid. A magazine published astonishing data on the influence of pomegranates on blood pressure and vascular function. Participants with hypertension who consumed pomegranate daily for 2 weeks showed a 21% improvement in arterial elasticity and a 12-point reduction in systolic blood pressure. Pomegranate increases the activity of the enzyme paraoxinase by 83%. This enzyme breaks down oxidized low-density lipoprotein, which sticks to the walls of arteries, forming dangerous plaques. Moreover, the pomegranate reduced the thickness of the arterial intimacy by 30% over a year, effectively reversing the aging process of the arteries by decades. The antioxidant capacity of pomegranate is 3 times greater than that of red wine and green tea, making it one of the most powerful products for protecting blood vessels from oxidative damage. Now, let's move on to number 1, the strongest supplement that made cardiologists rethink their views on treating cardiovascular diseases. Number 1 is ground hemp seeds. This is indeed a powerful supplement for combating artery blockage. Research related to these tiny seeds will astonish you. They contain the perfect ratio of omega-3 to omega-6, 3 to 1, which is necessary for the body to reduce inflammatory processes and cleanse arterial plaques. Hemp seeds contain a rare gamma-linolenic acid that dissolves plaques from the inside. The organism converts gamma-linolenic acid into dihomogamma-linolenic acid, which produces prostaglandin E1, one of the most effective anti-inflammatory substances. The study showed that participants who consumed hemp seeds daily for 8 weeks reduced their C-reactive protein levels by 73%, a key marker of arterial inflammation. Their low-density cholesterol levels decreased by 33%, but more importantly, the size of the cholesterol particles increased, making it less likely to stick to the walls of the arteries. Hemp seeds have actually changed the physical properties of cholesterol, making it less dangerous. Preparing hemp seeds is critically important to achieve maximum benefits. They need to be ground fresh every morning in a coffee grinder or mortar. Grinding breaks the outer shell and releases valuable oils and proteins. Add 3 tablespoons of ground hemp seeds to the oatmeal when it cools to about 49 degrees Celsius. This temperature preserves the delicate omega-3s while being warm enough to release the nutty flavor. Thoroughly mix the mixture and let it steep for 2 minutes. This time is necessary for the seeds to absorb moisture and release mucilage, a special fiber that binds cholesterol in the intestines and helps eliminate it from the body before it enters the bloodstream. One should not buy ready-made young hemp seeds as they oxidize within a few hours, losing up to 60% of their cardiovascular benefits. Hemp seeds contain all 9 essential amino acids, serving as a complete source of protein that helps repair damaged arterial tissues. Arginine, which is abundant in hemp seeds, is converted into nitric oxide. One study showed that daily consumption of hemp seeds increased nitric oxide production by 45%, significantly improving arterial flexibility and blood circulation. Scientists noted that such an effect is usually achieved with several medications, but here it was obtained simply by adding seeds to the diet. Just 3 spoons of hemp seeds provide 50% of the daily magnesium requirement, as well as significant amounts of potassium and iron, which are critical for maintaining healthy blood pressure and artery function. The study revealed astonishing results regarding artery regeneration. Participants with documented coronary disease who added young hemp seeds to their breakfast for 6 months were observed. Coronary angiography showed that 31% of participants experienced actual regeneration of previously blocked arteries with the formation of new collateral vessels around the damage. Hemp seeds contributed to angiogenesis, the growth of new vessels, creating natural bypasses around blockages. Participants over 65 showed even more significant improvements, indicating that hemp seeds become more effective with age. When you combine all 6 additives in the morning oatmeal, you create a cardiovascular superfood that encompasses all aspects of artery health. The synergistic effect of these components enhances their individual benefits. Your arteries do not become clogged overnight and do not clear overnight. However, with regular daily consumption of these 6 powerful supplements in oatmeal, you can literally reverse years of damage and protect yourself from cardiovascular diseases, strokes, and cognitive decline. Moreover, you will not depend on expensive medications with potentially dangerous side effects. You use food as medicine, as nature intended, to restore the cardiovascular system to optimal health. If you have any questions or comments, feel free to leave them below. Thank you for your attention.